Do you frequently feel like your heart pains sometimes, especially after eating fatty food or climbing stairs? Or maybe you get tired too quickly without doing much. These could be quiet signs that something is off in your blood, like too much fat floating around. That's where dyslipidemia comes in. Think of it like a traffic jam inside your blood vessels, caused by too much bad cholesterol, like LDL, or too little good cholesterol, HDL. It's not something you can see or feel directly at first, but over time, it can lead to bigger problems like heart attacks or strokes. It's like a slow leak in a car tire. You don't notice until the tire goes flat. And guess what? Millions of people have it and don't even know. So, are you curious how this happens and how to fix it? Let's find out together. So why does dyslipidemia happen? Imagine your body is like a kitchen. Sometimes the recipe goes wrong, not because you're a bad cook, but because you're using too much butter, oil, or sugar. That's what happens when you eat too much fried food, sweets, or processed snacks every day. Your liver, which acts like the kitchen manager, gets overwhelmed and starts making too much bad cholesterol. Other causes being overweight, not moving much, like sitting all day, or even genetics. Yes, if your parents had high cholesterol, you might be more likely to have it too. Some medicines, like steroids, or health problems like diabetes or low thyroid, can also mess with your fat levels. So it's not always your fault, but the good news is, many causes can be changed or managed. Here's a question. Have you ever felt chest pain when walking fast or going upstairs? Or maybe you've noticed yellowish bumps on your skin, especially around the eyes or elbows. These could be warning signs. But here's the tricky part. Most people with dyslipidemia feel absolutely fine at first. That's why it's called a silent problem. No fever, no cough, no pain, until one day, your doctor says you have a blockage in your heart. Some people get cramps in the legs when walking, or feel dizzy easily. Others might see fatty deposits under the skin. But honestly, the real danger is what you don't feel. That's why regular checkups are like giving your body a routine car inspection. Better to fix things early than wait for a breakdown. How do doctors know if you have dyslipidemia? Simple, with a blood test. It's like checking the oil level in your car. You fast for 8 to 12 hours, no food, just water. Then they take a small sample of blood. This test checks your total cholesterol, LDL, bad, HDL, good, and triglycerides, another type of fat. If the numbers are off, you've got dyslipidemia. Now treatment, it's not just about pills. First, doctors will say, let's change your lifestyle. That means eating more veggies, whole grains, and fish, like switching from burgers to grilled chicken and salad. Walking 30 minutes a day can help too. If that's not enough, they might add medicine like statins, which are like helpers that tell your liver to make less bad cholesterol. The goal, keep your blood vessels clean and your heart happy. Can you prevent dyslipidemia? Absolutely. Think of your body like a smartphone. If you keep it charged, updated, and don't overload it with junk apps, it runs smoothly. Same with your body. Eat healthy fats like avocado or nuts, not fried or packaged food. Move every day, even dancing at home counts. Avoid smoking and limit alcohol. Get your cholesterol checked every few years, especially if you're over 30 or have family history. If you're overweight, losing just 5 to 10% of your weight can make a big difference. Imagine cutting out one soda a day or taking the stairs instead of the elevator. Small changes, big rewards. Prevention isn't about being perfect, it's about being consistent. Now what's new in science? Researchers are like detectives, always looking for better ways to fight dyslipidemia. Recently, new medicines like PCSK9 inhibitors have been developed. They're powerful shots that help lower LDL cholesterol even more than statins. Some studies are looking at gene editing or RNA-based drugs that could fix cholesterol problems at the DNA level. Sounds like sci-fi, right? Also, smart wearables and apps now help people track their diet and heart health daily. And guess what? Scientists found that gut bacteria might play a role in cholesterol too. So the future isn't just pills, it's personalized plans based on your genes, lifestyle, and even your microbiome. Exciting, isn't it?